Our body possesses a powerful defense system called the immune system to protect us from virus and bacteria. However, when the body experiences abnormalities such as during infection, this immune system can sometimes go into overdrive and end up harming the body itself. This is the cytokine storm, immune system overreaction, we will explain here. When a cytokine storm becomes severe, it can lead to pulmonary edema, multiple organ failure, and in worst cases, death. Let's examine the mechanism and specific example of this phenomenon.
Cytokines are substances essential for immune cells to communicate commands such as virus detected and launch an attack to each other. Unlike hormones, they act more locally and have a relatively short duration of action. In simple terms, a cytokine storm refers to a state where the commands issued by immune cells become uncontrollable, causing the immune system to run amok. Normally, cytokines are secreted only in the necessary amount when immune cells like macrophages or T cells detect an enemy, and their levels are amplified as needed to defeat the virus. However, if for some reason, such as an infection, they continue to be secreted excessively, leading to extremely high concentrations in the blood. This triggers an excessive attack response. This response then attacks the body's own cells, which are not originally related to the virus. A well-known pathway in cytokine storms involves the cooperative action of the transcription factor NFKB and STAT3. This activates the amplification circuit for the immune-related protein interleukin-6, leading to an abnormal increase in the production of inflammatory cytokines. Other factors such as TNF-alpha, IL-1, and chemokines can also contribute. The result is a state of severe, uncontrolled inflammation known as a cytokine storm.
How does the immune system mean to protect us go into overdrive? When the immune system functions normally, upon viral invasion, immune cells release cytokines to summon allies and attack the virus. Once the virus is eliminated, cytokine release stops and inflammation subsides. However, in a cytokine storm, an unknown virus or similar invader triggers the immune system to panic, releasing massive amounts of cytokines. Immune cells responding to these commands gather in large numbers, and these immune cells then release even more cytokines. The uncontrolled immune cells begins attacking not only the virus, but also normal body cells and organs, such as lungs, kidneys, and blood vessels. Blood vessels become damaged, leading to blood clots forming or blood pressure dropping sharply. In the worst cases, multiple organs cease functioning, leading to a vicious cycle of multiple organ failure. In essence, the biological reality is that the inflammatory response, which is meant to protect the body, becomes unstoppable, like a car with broken brakes.
When does a cytokine storm occur? The most familiar example is COVID-19. While many patients experience only mild symptoms, some suffer a rapid worsening of pneumonia. This is thought to involve not just the virus's replication, but also a cytokine storm where the body's own immune system violently attacks lung tissue. Historically, the Spanish flu, which claimed many young lives, is also said to have had cytokine storms as a major cause of death. One theory suggests that the high mortality among young people who typically have strong immune systems occurred because their robust immune systems instead went into violent overdrive. Furthermore, cytokine storms can be triggered not only by disease but also by medical procedures. For instance, treatments that artificially activate the immune system, such as the latest cancer immunotherapy, can sometimes cause cytokine storms as a side effect.